Welcome to Lecto. Today we are going to discuss rules of development in pediatrics. Before we start, we should know the difference between growth and development. Let's start. Growth is basically the increase in the size of the body, and development is basically the growth in the psychomotor capacity. So, growth is basically the increase in the size of body. When the size of body increase, then it is called growth. And development is basically the growth in psychomotor capacity. So what is psychomotor capacity? It is a capacity through which the child can learn something, move towards something, walk, think. So this is actually the psychomotor capacity. So growth in the psychomotor capacity is basically the development. The milestone in the development is basically the maturation of the nervous system. So most important is the maturation of nervous system. So this is very much important. If someone wants to check whether nervous system of a child is growing or developed properly or not, so there are 6 rules through which we can check that the nervous system of the child is developed properly or not. So here you can see there are 6 rules. First one is the continuous process. Actually, development starts in the uterus and at the puberty. So basically, developmental processes start in the uterus and it end at the puberty. And during this process, nervous system continuously mature, and in that period a child learns lot of things, and he or she it start thinking about the environment and about different things. Next one is the functional maturation. So in that situation there are 3 points through which you can easily understand what is functional maturation. So here, maturation of nervous system, then practice, then skills. So here you can see there are 2 child. Number 1, number 2. Number 1 child nervous system does not mature properly. So here is the point. Child 1 nervous system does not mature properly. And if the nervous system is not mature, then after practice, child 1 cannot learn any skill, even though if we do practice on him. So this is the case of child 1. And second one is the child 2. In that situation, child 2 nervous system mature properly, but In that situation, if we do not practice to learn a child, then child too again cannot learn any skill, even though his nervous system mature properly. So this is the situation. First one, child 1 nervous system does not mature, and due to immaturation he cannot learn any skill. Second case is that nervous system mature properly, but we do not practice to learn him, due to which he cannot learn any skill. So this is the two case. Third one is the attainment of milestone. Milestone means maturation of the nervous system. So nervous system maturation starts and it continues in a sequence. So like example, you can easily understand with the example that the child babble first, then speak in words. Babbles mean murmur, which does not have any meaning. So this is the case. Child start babbling before speaking words, just like child start sitting before standing. Next is the direction of development. So direction of development, you can see that here is a child. It can develop or grow in two directions. First one, actually it will develop from head to toe, which is called cephalocaudal direction. Keep remember, the growth will be downward. And this second one is the, if we talk about the limbs, upper limbs, the upper limbs will develop or grow in proximal to distal direction. The growth of the upper limbs will be away from the trunk of the body. If we talk about the example that the child start moving hand first before they start moving their fingers. This is very much important, that child start moving his hands first before they start moving its or his finger. Second one is the reflexes. Some reflexes have to be lost to check whether nervous system mature properly or not. There are two reflexes: grasp reflex and tonic neck reflex. So grasp reflex is basically in that situation, if we put a finger on the child's hand, then he will start curling his finger. So this is actually the grasp reflex. With the passage of time, this reflex should be diminished. If it doesn't, then it means that there is some abnormality in the nervous system. So grasp reflex should be diminished after some time. Tonic neck reflex is that reflex when we turn head of the child or infant, then the side which is from which we turn the head, these sides limbs will expand while the opposite limbs of the child will reflex. So this is basically the tonic neck reflex. Again, if it does not diminish, then it means nervous system, there is some abnormality in the nervous system. So this is basically the reflexes. Second one, last one is basically the disorganized activity. If we do, I'll show you an example so you can easily understand what I am trying to teach you. Here is a 4 months child, and here is the 4-year-old child. Here 2 childs. If a toy is shown to them, then the 4-month child will cry with excited, and he starts moving its hand, and he start moving his hand with excitement. But if the same toy is shown to 4-year child, then he saw the toy and he smiled and asked about it, what it is, what toy it is. So this is basically the difference. In that situation, 4-month child do some immature activity, but 4-year-old child do some mature activity. If, let's suppose, if the 4-year boy saw the toy and start crying and start shouting and moving its hand, then it's mean there is some abnormality in the 4-year child. And which abnormality? Nervous system abnormality is present in the 4-year child. So this is all about the basic rules of development through which we can check whether the nervous system is work properly or not. If you have any question, then you may ask in the comment section. Thank you.